B.Y., Dr. Jamaluddin bin H.J. Mohammed. Endocrine System. By Dr. Jamaluddin bin H.J. Mohammed. Packard Parenting Pediatric Hospital Tuang Kufaja. Kanger, Perlis. Function of the endocrine system. Water balance, controlling the solute concentration of the blood. Uterine contractions and milk release, delivery of the newborn and breast milk flow. Growth, metabolism and tissue maturation. Many tissues, adult features. Ion regulations regulates Na+, K+ and Ca2+ in the blood. Heart rate and blood pressure regulation for physical activity. Blood glucose control. Immune system regulations. Reproductive functions control. Hormones. Definition: secreted by the endocrine glands, ductless gland, its effect away from the gland's target tissue. Intracellular chemical signals transported in the blood. Receptors membrane bound. Intracellular. Hormone bound with the receptor to produce effect. Endocrine system. Hormone, peptide, proteins. Steroids, lipid. Regulation of hormone secretion, sometimes regulated by other hormones. Other hormones. Prostaglandins, inflammation. Erythropoietin production. Human chronic gonadotrophrus, placenta. Hormones, protein, lipids or peptides. Protein, most peptide hormones bind to receptor on the cell membrane, cause permeability changes. Production of intracellular chemical signals. Lipid, soluble hormones. E.g., steroid and thyroid hormone. Effect, enter the cell and bind to receptor inside the cell. Effects. Regulator of hormone secretion. Secretion of hormones is controlled by negative feedback mechanism. Secretion of hormones controlled by chemical. Other hormones. Nervous system, pituitary and hypothalamus. Pituitary, infundibulum, brain. Anterior and posterior pituitary. Section of hormones from anterior pituitary controlled by hormones from hypothalamus. Section of hormones from posterior pituitary controlled by action potential secreted by axis from the hypothalamus. Anterior pituitary. Growth hormone, GH. Thyroid stimulating hormone, TSH. Adrenocorticotropic hormone, ACTH. Luteinizing hormone, LH. Follicle stimulating hormone, FSH. Prolactin. Melanocyte stimulating hormone, MSH. Posterior pituitary hormone. Antidiuretic hormone, ADH, oxytocin. GH. Increase protein synthesis. Breakdown of lipids. Glucose level. Somatic growth. TSH. T4, T3 secretions. ACTH. Glucocorticoid secretion, e.g., cortisol. Skin pigmentation. MSH. Melanin production. LH. Ovulation, progesterone production. Testosterone production, FSH. Follicle maturation and estrogen secretion in ovary, sperm production. Prolactin. Stimulates milk production. ADH. Water reabsorption, regulation of blood volume, oxytocin. Urine contraction. Milk letdown. Thyroid gland. Thyroid hormones, thyroxine, D4. And triiodothyronine, T3. Function. Metabolic rates. Normal process of growth and maturation. Calcitonin. Parafollicular cells. Function. Ca2+ level, resolute Ca2+ level. Rate of bone breakdown. Parathyroid glands. PTH, parathyroid hormone. Function. Bone breakdown by osteoclasts. Vitamin D synthesis. Ca2+ levels, adrenal. Medulla, epinephrine, norepinephrine. Epinephrine, norepinephrine. Cardiac output. Blood flow to skeletal muscles, heart. Glucose in the blood. Fatty acids. Prepare body for physical activity. 2. Cortex, mineralocorticoids, aldosterone, glucocorticoids, cortisol, and androgens. Na plus reabsorption and water retention. H2O excretion, blood concentration. Pancreas, insulin, glucose and amino acids. Uptake in tissue, liver. Skeletal muscle. Adipose tissue. Islets of Langerhans alpha cell glycogen. B cell insulin, B, cortisol. Fat and protein breakdown. Glucose, CHO metabolism. Maintain blood pressure. Inhibit inflammation and immune response. C. Androgens. Female sexual drive, pubic hair and axillary hair growth. Glucogen breakdown. Glucose level. Renin, pathway. Angiotensinogen. BP renin. Angiotensin I. Angiotensin II aldosterone secretion. Vasocontraction BP Na plus retention. K plus excretion. H2O retention, reproductive organs testes testosterone, sperm cell production. Maintenance of functional reproductive organs, secondary sexual characteristics. Male sex behavior. Ovaries, estrogen and uterine and mammary gland. Progesterone development and function. External genitalia. Secondary sexual characteristic. Sexual behavior. Menstrual cycle. Thymus gland thymosin, promotes immune system. Development and function. Pineal body melatonin, regulate the onset of puberty. Calcium metabolism. Calcium level is maintained if Ca2 plus PTH secretion. Calcitonin breakdown of bone matrix. Secretion by osteoclasts. Ca2 plus release. Breakdown of Ca2 plus reabsorption in the kidneys. Bone matrix by Ca2 plus reabsorption from small intestine. Osteoclasts, through VT. D. If Ca2 plus levels stimulate parathyroid gland. PTH secretions. Calcitonin breakdown of bone matrix by osteoclast. Secretion Ca2 plus release. Ca2 plus reabsorption by the kidneys. Breakdown vitamin D synthesis Ca2 plus. Of bone matrix absorption from the small intestine. Regulation of blood glucose level. Glucose pancreatic islet cells. Insulin secretions. Uptake of glucose by the tissues. Glucose glycogen, skeletal muscle, liver. Glucose adipose tissue. Glucose level. Glucose pancreatic islet cell. Insulin secretions. Insulin is an anabolic hormone,